Hey, it's me, Dr. G. Chances are that if you live in Florida, Texas, or Arizona, there is a high likelihood that your local hospital is in capacity crisis mode or rapidly approaching it. As we see the number of newly confirmed COVID-19 diagnoses rapidly rise in these areas, we are almost certain to see a subsequent rise in people needing to be hospitalized with acute complications related to COVID itself. Hospitalizations always lag behind the time when patients become infected. Physicians and administrators in many hospitals have been planning for surges like this, and we know that some hospital systems are already brewing at capacity. Newsweek reported last week that Houston's Texas Medical Center, which is considered the largest medical complex in the world, has a 100% capacity. The Arizona Republic reported that as of yesterday, 88% of ICU beds and 84% of current inpatient beds were occupied, and they are expecting these numbers to worsen. Earlier this month, CBS Miami reported that 75% of adult ICU beds were occupied in Florida. So what does this all mean? And why should you care if you live in these states? Number one, if you or a loved one gets acutely ill with anything that requires evaluation in an emergency room with potential hospitalization, then it may be very difficult for your hospital to provide the care you need if it is full. Number two, if you are a patient who already faced a delay in your elective surgery in March or April and still have not had it done, be prepared to wait longer. Just late last week, Governor Greg Abbott of Texas suspended all elective surgeries in 4 counties to ensure bed availability for COVID-19 patients. According to the Department of State Health Services, as of yesterday, the total number of people hospitalized in Texas with COVID-19 is not only equal to the total number of available ventilators, but also far exceeds the number of available ICU beds in the entire state. As a comparison, my home state of Illinois is doing pretty well. According to the Illinois Department of Public Health, our ICU beds are only at 50% capacity and 75% of our ventilators are still available. The real reason why things have shut back down in Florida, Texas, and Arizona is that the hospital systems may be completely full in the next 2 to 3 weeks and not be able to care for you. As a physician, the bottom line is this. This virus has not been eradicated. Believing that we have it under control would be like believing in magical unicorns. We still have hard work ahead and more tough decisions to make. My advice to people living in Florida, Texas, and Arizona remains the same as what I would offer to others living elsewhere throughout this great land. Wear a mask, wash your hands, and watch your distance. Peace out.